Here, few question and answer we are going to discuss. The first question is, a client is being prepared for a thoracentesis. The nurse should assist the client to which position for the procedure. The keyword is here, thoracentesis. It is the process by which excess fluid is removed from thoracic cavity or from the lungs, like pleural effusion. Examiner asks, when nurse should assist the client to which position for the process, right? Number one, patient lie down or in bed on affected side, and patient lie down in bed on the unaffected side. Number two, Sims position with head of the bed flat. And number four, prone with the head turned to the side and superior by pillow. There are four options. First of all, I want to share with you, every student is sure number 3 and 4 is not an answer. Sims position, the position to examine the rectum or put the enema. But thoracentesis in my chest area, we withdraw the fluid. Prone, when patient lie down over the abdomen, not related to this. Number 1 or number 2, anyone, right? So when we remove the fluid from the lungs, the patient position is very important. Most patients are supposed to be sitting position, holding two hands over the pillow on the table, or patient sitting at the edge of the bed. So the nurse should assist the client in which position for the process. They ask about this. So also, not only the sitting, if patient lie down, patient is supposed to lie down on the bed on unaffected side, right? So number 2 is supposed to answer unaffected side if lie down. Also, sitting position is okay. So what is their explanation? To facilitate to remove a fluid from the chest, like pleural effusion, fluid is accumulated. The client is positioned sitting at the edge of the bed and leaning over the bedside table with the feet support on a pole, or lie on a bed on unaffected side. So both is correct, either sitting right on the edge of the bed but leaning over the bedside table, or lying down unaffected side. Head of the bed elevated 30 to 45 degrees. Or prone and Sims position are inappropriate for thoracentesis. What is next? Here, the next question will go. The nurse is prepared to care for a client, has returned to the nursing unit following the cardiac catheterization and performed through the femoral vessel. So a patient needs the cardiac catheterization catheter performed through the femoral vessel. You see the keyword, cardiac catheterization through the femoral vessel. This is the keyword. The nurse check the nurse check what? The healthcare provider's prescription and plan to allow which client position or activity following the procedure. Right? Number one, bed rest in high polar. Bed rest with bathroom prevalence only. Bed rest with head elevated 60 degree. And bed rest with head elevation on greater than 30 degrees. This question you have to read very carefully. Is it before the procedure? Is it during the procedure? Or it is after the procedure? It is important. So the nurse is preparing to care for a client who has returned. So after care, after the procedure, post procedure care, right? Post procedure here. So after cardiac catheterization, so it is important what should be the patient position of the legs or extremities. Is it straight? It is bending. Okay. So after catheterization, we always prefer the bed rest with head elevated, no greater than 30 degrees, not a 60 degree, not a high polar. If you do this, it will be more pressurized in the femoral arteries because catheterization have done in the femoral areas. For the femoral vessel, the question said, what is their explanation? So after the cardiac catheterization, the extremity means two legs into which the catheter was inserted is kept straight for 4 to 6 hours. The client is maintained on bed rest for 4 to 6 hours, and also the client may turn from side to side. The head is elevated no longer than 30 degrees. No, 30 degrees. So if it is more than that, it can cause the more pressure in the extremities. Although some healthcare providers prefer a lower position or flat position until hemostasis adequately achieved, means until blood bleeding stopped. What next? So next question is here. A client is about to undergo a lumbar puncture. The nurse described to the client that which position will be used during the procedure. So the Question before this, we talked about the thoracocentesis, then femoral catheterization, and this question about the lumbar puncture. So the client, in case of lumbar puncture, what should be the ideal position? During the procedure, what should be the position? Side lying with a pillow under the hip. Side lying, not a position for lumbar puncture. Or prone with a pillow under the abdomen. Prone means lie over the abdomen. It is not a position for lumbar puncture. Prone with a slight Tandelberg means head is down but two legs is up. We call Tandelberg. If patient has a shock, need to more blood supply to the brain, we can do this, but not for lumbar puncture. The remaining is one side lying with the edge with the legs pulled up and head is bent down onto the chest. This is the position for lumbar puncture. What is their expression? A client undergoing lumbar puncture is positioned lying on bed with the legs pulled up to the abdomen and head is bent down into the chest. This position helps to open the space between the vertebra and allow for easier needle insertion by the healthcare provider. The nurse remains with the client during the procedure to help the client maintain this position. And other option, identify incorrect position for the procedure. So what we learn from here, if any patient needs lumbar puncture, during the procedure, patient should be side lying with the legs pulled up and head is bent down into the chest. Next question, apply all. So the nurse is provided information to a client scheduled for a dual X-ray absorptiometry, shortly called DEXA. So which information should the nurse provide the client? It is a dual X-ray absorptiometry, right? So about this test, what are the important? So these diagnostic tools we do for or to check the bone's mineral density. So dual X-ray absorptiometry or DEXA test we do to check the bones minerals density to check. So about this test, what is the important information we choose from here? It is painless test. So DEXA is a painless test. It is true. It emits slightly more radiation than a chest X-ray does. So it is actually emits slightly more. No, it is slightly less than the radiation or chest X-ray, not more. upper body clothing will need to remove the testing. It is not need to remove. Increase the fluid intake is necessary following the procedure. Intake fluid is nothing wrong, but it is not mandatory that patient should increase fluid intake following the procedure, because no dye is get in. I need to out from the body. And metallic objects such as jewelry, belt may interfere with the test and need to be removed. Yes. Any kind of metal from the body or jewelry we have to remove, because it is the radiation or rape will pass through the body. What is their rationale? Most common used scanning and also diagnostic tool for measuring the bone minerals density, right? Mineral density. And it is a painless test, and that emit less radiation than a chest X-ray. A height is taken before the start of the test. The client stays dress. The client can wear the dress, but it is asked to remove any metallic objects such as belt, coins, keys, or jewelries, because they may interfere with testing. No special follow-up care for the test is necessary. What next? Next here, the nurse is working in a outpatient radiology department and is giving the discharge instruction to a client who has had a bone scan. Which instruction should the nurse include the client teaching plan? So, outpatient facility, radiology department, and what education need to instruct to the client who had a bone scan, right? Out all of the teaching which is important from here. So the test is bone scan, right? So if before any test, if any patient need to drink any dye or put any dye through the blood, always we tell our patient to drink enough fluid. So a good amount of fluid or drink can expel out the radioisotope substance from blood through the kidney. So what is our answer? Report any feelings of nausea or flushing. It is common. Avoid eating very much for rest of the day. So they said which one we have to include in instruction. Drink extra water for the day, so or after the procedure. This is the answer. Because bone scan, radiopaque substance can expel out, and try to go up or downstairs at least twice before the end of day. It does not relate to this question. So number 3 is the answer. What is rationale? The client should drink a large amount of water for 24 to 48 hours to excrete the radioisotope through the kidney. No special diet or activity, prescription or restriction are required after a bone scan. Nausea or flushing would accompany allergic reaction to a drug, which is not used in this procedure. What next? Next question here. A magnetic resonance imaging, and this is called MRI. So a magnetic resonance imaging study is prescribed for a client with a suspected brain tumor. Which priority action should the nurse include in the client plan of care to ensure the safety? So which priority action? When a patient needs to MRI. So first of all, here, shape the groin for insertion the femoral catheter and remove all metal containing object from the client. Inform the client to remain motionless throughout the procedure. Instruct the client to imbalance techniques, inhalation techniques for administration of the radioisotope. At least number 3 and number 4 is not an answer about MRI. It is the radio frequency pulse in a magnetic field are cover the patient. So inform the client to remove all of the metallic substance. This is the answer, right? Why it is answered and what is the rationale? They said when patients need MRI, all metallic objects such as ring, bracelet, hairpin, watch should be removed. In addition, a history should be taken to ascertain whether the client has any internal metallic device such as pacemaker or any orthopedic or orthodontic hardware, orthopedic dentic pacemaker. Insertion of femoral catheter is not a part of the procedure, and the client needs to be motionless throughout the procedure for quality of the scan. But this action is not related to a safety issue and therefore is not the priorities. What next? Next question here, the client is to undergo the pleural biopsy at bedside. When planning for any potential complication of the procedure, the nurse should have which items available at the bedside? Easy question. When a patient go for the pleural biopsy, sometimes patient turns to the perforation because pleural biopsy means it is the lungs, right? So we will be prepared with some equipment. We'll be ready to face any kind of accident. So first one, which items available should be intubation tray, morphine sulfate injection, portable chest examination, and chest tube and drainage system. Because patient is undergo pleural biopsy at the bedside. If any complications start, we give them chest tube and also drainage system. Morphine will not cause any effect here. Chest X-ray, any not can work. Intubation tray, we can keep it, but first priority chest tube and drainage system should be there. The complication following the pleural biopsy include hemothorax, means blood in the lungs. Pneumothorax means air in the lungs, or hydrothorax, hemothorax, pneumothorax, or hemopneumothorax, both. Temporary pain from intercostal nerve injury, also common. The nurse should have a chest tube and drainage system available at the bedside for use if hemothorax or pneumothorax develop as a complication. An intubation stay is not indicated. The client may be pre-medicated before the procedure, or a local anesthetics is used. A portable chest X-ray machine would be needed. Specify placement of the chest tube if one was inserted, but it is unnecessary to have at the bedside before the procedure. What next? And next question here, select all. So the nurse has a prescription to obtain 24-hour urine collection in a client with the collection the patient who have a renal disorder. Which action should the nurse take when collecting the specimen? Select all. So a patient need 24-hour urine collection. What are the procedures we should follow? Okay. So number one, explain the procedure to the client. Definitely. Always we will explain it to the patient. It is the first priority. Explanation, take the informed consent, and also save all subsequent voiding after the first void during the 24 hours. It is absolutely true. And here, during the collection period, place the main container on ice or in a refrigerators. So this 24-hour, we need to collect the urine, and we could put it in the refrigerator. Otherwise, bacteria will develop. It is the choice as well. And have the client void at the end time, and place the specimen in a main container. It is true. Number 5, have the client void at the first time and place the specimen in a main. No, first time we will not put So what is the rationale? They said the nurse should first explain the procedure to the client and ask the client to void at the beginning of the collection period and to discard this urine sample. All subsequent voided urine is saved in a container which is placed on ice or refrigerated. The client is asked to void at the finish time, and this sample is added to collection. The container is labeled, placed on fresh ice, sent to laboratory immediately. What next? Next question here. How should the nurse position the client for pericardiosis to treat the cardiac tamponade? So, like a patient need to go for pericardiocentesis, so what should be the position? So first one here, supine with slightly tendon work. Tendon work position always will shock when patient need blood supply to the heart. Not for this. Lying on a right side with a pillow under the head. Right side position, no. Lie on the left side with a pillow under the chest wall, and supine with the head of the bed elevated at 45 to 60 degrees. So cardiocentesis, right? We do something over the heart. Definitely, patient should be supine with the head of the bed elevated at 45 to 60 degree angle. Why and what are the rationale? They say the client undergoing pericardiocentesis is positioned supine with the head of the bed raised to 45 to 60 degree angle. And this placed the easier insertion of the needle into the pericardial sac. This is the reason. What next? Here, another specimen we chose. This one, the stool smear for a culture need to be obtained from a client. What steps should the nurse plan to implement when obtaining stool specimen? Right, select wall. So, wear a sterile gloves, definitely. So when we collect a specimen like stool, we always wear or use the sterile gloves. Also, use a sterile container, definitely sterile container. And refrigerating the specimen. Basically, after collect, we send it to the lab. The stool immediately will send. So number 3 is not answer. Send the specimen directly to the laboratories. Positioning the client in a dorsal recumbent position, definitely no. So what is their explanation? A stool smear specimen is obtained And using a sterile gloves and sterile container. After obtaining the specimen, the stool is sent immediately to the laboratory. And storing a stool specimen for a culture in a refrigerator is contraindicated because it will be contaminated. And also, it can retard the growth of organism. The client needs to be positioned in a lateral recumbent position to obtain the specimen, not a dorsal position. What next? Next question here, the nurse is caring for a client with possible cholelithiasis who is being prepared for intravenous cholangiography and is teaching the client about the procedure. Which statement indicate that the client understands the purpose of test? So patient cholelithiasis means stone formation in gallbladder. And patient need intravenous cholangiography. So we put something through the biliary system and take the picture of hepatobiliary system, like gallbladder, cystic duct, hepatic duct, common hepatic duct, common bile duct. So about the teaching, which one is correct? It means patient is understand the procedure. So what statement indicate that the client understand the purpose of test? My gallbladder will be irrigated. So it is cholangiography. It is the diagnostic test, nothing therapeutic to remove the test. No. This procedure will drain my gallbladder. No. This will put medication in my no. It is only take the picture to find out how many stone, where the location of the stone, type of stone. They are going to look at my gallbladder and duct by cholangiography. An intravenous cholangiogram is done for diagnostic purpose. It outlines both the gallbladder and duct. And so gallstone that have moved into the ductal system can be detected. X-ray are used to visualize the biliary duct systems after the intravenous insertion of radio opaque dye. This test is diagnostic and does not involve irrigation or installation of medication or drainage of gallbladder. What next? A client is about to undergo the lumbar puncture. The nurse should tell the client that which position will be used during the procedure. So prone is slight handlebar, no. Side lying with a pillow under the hip, or prone with a pillow. Prone means lie on the abdomen. But when patient need lumbar puncture, always patient should be side lying with the legs pulled up and head bent down into the chest. This should be the ideal position for the patient. Why? The client undergo lumbar puncture is positioned lying on the side, with the legs pull up to the abdomen and head is bent down into the chest. This position helps to open the space between vertebra and allow for easy needle insertion by the healthcare provider.